Good morning. Welcome to the official launch of the North Country Telemedicine Project. We are pleased with your interest in this project and in the impact it will make on access to health care in the North Country. We need to express our thanks to the people and organizations who have worked so hard over the past 3 years to make this possible. Our federal partners who secured the matching funds, and of course the FCC for recognizing the value of this project, but more importantly, the boots on the ground folks at each of our 5 hospitals in the Fort Drum region, our 3 health departments, and of course the North Country Children's Clinic, who have worked so hard alongside us and with DANK, to make this happen. We are proud to be one of the very few pilot projects in the country that has come this far. And we are proud to have our U.S. Congressman, who is so knowledgeable about health care, here with us to celebrate this launch. Please join me in welcoming Congressman Bill Owens, our 23rd Congressional District Representative.
Thank you. Thanks. I'm delighted to be here, and thanks to the participants in this process. Certainly DANK is very responsible for the growth of this program, the Fort Drum Regional Health Planning Organization and the Development Authority of the North Country. When one looks at health care in the North Country, that's throughout the district. All of our communities really experience the same issue. Long distance to travel for specialty care. Few specialists are available in the communities. This type of utilization of technology will not only assist families in access to care, but it will improve the quality of care and drive down the cost of care. All things that we're very concerned about. And I can only congratulate all of you on getting this done, being a pilot program, and being the initiators of a very important process for all of our families here in the North Country. Thank you very much, and thanks for having me.
Thank you, Congressman Owens, for your support. It is obvious, without a fiber network to be connected to, without a backbone, we could not be here delivering telemedicine over it. So it is now my pleasure to introduce the man who leads the organization who built the backbone. Please welcome Mr. Jim Wright, Executive Director of the Development Authority of the North Country.
Thank you very much, Denise. It's a pleasure to join Congressman Owens and the Fort Drum Regional Health Planning Organization this morning and all of its members here at the Children's Clinic to launch the telemedicine network. This is just an extension of the over 800 miles of fiber that the Development Authority operates regionally, and this is the kind of specialized network that we envisioned 5 years ago when the regional network was first lit. This telemedicine network provides a specialty service that is available to the 28 providers in the region, so it enhances the capacity here in the region, it increases the quality of life for the residents of the region, and that was the purpose for the technology investments. We're very pleased of the network that we have. It covers 3 counties and extended into a 4th county now. In turn, it also provides broadband technology capabilities that we can provide at speeds up to 100 megabits per second. So it's state-of-the-art infrastructure here in the region. The telemedicine project is but one more example, and I'd be remiss if I didn't recognize the 2 gentlemen who made it happen. Dave Wolf, who's the division manager for telecom for us, and Steve Smithers, who is the project leader. These are the smart guys that make this technology work here in the region that we can all avail ourselves of. So our appreciation to our partners wouldn't have happened without the federal money. We're very appreciative of that, and we're very proud to be one of 5 in the nation that are lit at the present time. Thank you.
Thank you, Jim, for the strength that DANK brings to the North Country. Well, together we built a network, but fiber is only fiber until we start using it. until we start using it as a tool to bring access to health care to our community. Someone had to step up and say, we will be the ones, we will be the first to bring this care to our patients. I don't think it will surprise anyone in this room that the ones to step up were the North Country Children's Clinic. They came forward to be the first to launch a telemedical application over this fiber network, telepsychiatry with Upstate Medical Center for the children and families they serve. It is my pleasure to introduce Aileen Martin, the Executive Director of the North Country Children's Clinic.
Thank you. Thank you. We are proud to be the launch of the telemedicine network. We're proud that telepsychiatry is the first application on the network. We know firsthand from working with families how difficult it can be when your child has a mental health diagnosis and trying to get that kind of quality care in your home community. Very often children have to be sent away, and that's just heartbreaking and gut-wrenching for families. And so we're so happy to finally be able to offer this service in our home communities and do one more step to keep children healthy and with their families in their home community. So thank you very much. Thank you to Development Authority of the North Country. Thank you, Congressman Owens, for the federal support for the funds. Thank you to the tech teams everywhere. Being the first on a network is very difficult technology to make it all work, so thank you to all of you who helped make this possible.
Before we move to the ribbon cutting, I would like to introduce someone who is not in this room with us, but is here with us. He is available telemedically in the telemedicine room, Dr. Montosh Dewan, who is the chair of Upstate's Department of Psychiatry. So please have a conversation with Dr. Dewan when you move into the other room.
1, 2, 3, go ahead.